Hi, everyone. Welcome back. This week is World Immunization Week, and today we're joined by Dr. Donna Barhorst, Medical Director of Intermountain Medical Group Pediatric Service Line, who has practiced at Northern Utah Pediatrics for the last 25 years, to talk about well child checkups and immunizations to prepare for the COVID-19 vaccination. Last year, many families postponed or canceled their children's well child checkup in the middle of the pandemic. While some have been able to catch up, doctors at Intermountain Healthcare are encouraging parents to schedule these important visits for their families. Donna, thank you so much for joining us. I'd love to start by having you introduce yourself and what specifically you do here at Intermountain Healthcare.
I'd be happy to. So I'm a general pediatrician, and like you said, I practice at Northern Utah Peds up in Ogden. But in addition to that, I have the administrative role of the senior medical director for the pediatric service line. And what that entails is leading our pediatric providers, which is both physicians and APPs across the state. And there's over 100 of those at 17 different locations. And me with my AMD team, we kind of are the fearless leaders for that group and help to promote really the well-being of children across the state.
I want to talk about why well child checkups are so important. Can you give us a little overview of what makes those visits so important for the parent and the child themselves?
Absolutely. So a child is a growing and developing young little person. And during that time, there's rapid change. And really for the first 18 years to 21 years of life, it's a very dynamic process. And so the well child visit is really our opportunity to really promote the total well-being for a child. It is not just about the immunizations, it's about assessing their growth, their development, providing counseling around safety and sort of wellness activities, plus asking, and answering the questions that parents have about how to raise a thriving, healthy child.
And how often should parents be taking their children in for these visits? Does it vary at all based on age?
It absolutely does. And so in the first 2 years of life, they're very frequent. We begin usually at a couple days of age in the first week after the discharge from the nursery. Then at 2 weeks, 2 months, 4 months, 6 months, then 9 months of age. And then we spread them out to about every 3 months, which is at 12, 15, and 18 months. And then after age 2, we encourage a well child visit in the middle of that year, so 2.5, and then every year after that until the child reaches adulthood, which is 18 to 21 years, depending on the practice site and the family.
So it's not just a once a year thing, depending on who you are. It could be more than that or every other. It really does depend on the age, which is good to know. I didn't actually know that. So we've been hearing a lot about the COVID vaccine being ready for, or starting to be ready for children that are going to be younger than 16 in the near future. Why is it really important to get these other vaccines before getting the COVID vaccine?
Absolutely. So the hope is that we'll be able to vaccinate children from 12 years up, starting sometime this summer. Currently, we can vaccinate anyone who's 16 years of age or older. And when the studies were done for the COVID-19 vaccine, they weren't done in comparison to when other vaccines are administered. And so the adult providers and recommendations have been to space any vaccine by at least 14 days. So if you have a child who's coming in for their junior high visit, and there's vaccines that are associated with that. If we don't get those done before we are able to provide the COVID-19 vaccine, we're going to have to space that by that 2-week interval on either side of the vaccine. And that's going to become much more complicated. So I think the recommendation is, really use this window of opportunity to, to kind of catch up. If your child has not been seen in the last year in the school age, age group, then please call and get an appointment with your pediatrician or your family physician to get that well child visit completed. If they're younger than that, it's still very important because many of our families kind of paused their well childs last year because of concerns around exposure to COVID. We also had to to redistribute sort of our priority on who could be seen so that we could, take care of what we needed to do and respect the social distancing and doing our best to keep everyone safe. So this is the window of time that we really want to promote that kiddos get in. We're coming into the spring, summer months, and, there's more time and flexibility in family schedules at this time. So we're asking people to really look and see, hey, has Johnny or Susie been in? Nope, they haven't. Let's get that scheduled.
And as far as those different immunizations go for different age groups, is the primary care provider the person who's going to be able to provide you with that information, or is there resources that someone can access to find out what your child should be getting at what specific age?
Absolutely. So there's great resources on the American Academy of Pediatrics website, also the CDC website. The vaccines are different based on the age of the child, but the pediatricians and family physicians and the APPs who do their work, this is what we do. We can tell you exactly what vaccines your child needs when they come to the visit. The also nice thing is we have the USIS, which is the Utah State Registry for Vaccines, and so we can check and see if there's any deficiencies or gaps and be able to provide the most up-to-date information about what vaccines a child needs when they come.
Let's talk a little bit more specifically about the COVID vaccine. You mentioned that we could expect to see 12 to 16-year-olds being able to access the vaccine sometime this summer. Are we seeing the same type of promise in this vaccine in children that we are in adults? Is the safety and everything that's happening the same? Can you just give us a little bit more information about that?
Yes, absolutely. The vaccine has been shown to be safe and effective in preventing severe COVID-19 disease. And the reason why that is so important in our children, not to keep them safe, but also because it provides safety for everyone who they come into contact with. And one of the blessings has been that younger children, for the most part, have milder illness with COVID-19. Now, there are some very severe complications that can occur if a child gets COVID-19, but they can be a reservoir for exposure for the elderly or for other populations that are at risk. So if we're able to vaccinate a larger cohort of our kids and our teens, then we'll keep the whole population safer and we'll be able to get to that herd immunity sooner.
What if you don't have a doctor, a primary care provider yet for your child? Is there a process to start that appointment? How does someone find who they can actually go to start checking in on these well child checkups?
Absolutely. We have a host of very, very, very well-trained, wonderful resource of both pediatricians and family physicians across our state. Most folks have online resources where you can look if they're taking new patients. Here at Intermountain, we have that resource available. And then just calling and say, I want to establish my care for my child with your pediatric practice. And all of us are taking new patients and happy to serve in any way we can.
And Donna, what do you feel like is the most important thing that someone should know about immunization? Sometimes I know people are a little bit nervous if it's not something they've heard of or have done their own research on. What are some reassuring thoughts you can give to people around these vaccines that have been given out to their children?
Immunizations are truly a medical marvel. I've been in practice long enough that I've seen children who have had severe complications and even died from some of these diseases that we can now protect against. The vaccines that we now provide are very safe. They've been time tested, and I can tell you that I've been a pediatrician for almost 30 years. It really is important that we vaccinate our kids because we have been able to eliminate many of these childhood diseases. But if we stop vaccinating, they will resurge. Things like measles, pneumococcal pneumonia, H flu disease, these are all things that are life-threatening illnesses that we've been able to control by vaccinating and having herd immunity for our children. So it is one of the 20th century medical marvels, and we really need to be responsible and make sure that all children can have access to those vaccines.
I think that the medical marvel piece is really interesting. You think about polio or any of these diseases that used to exist that we've basically eradicated now in the 21st century and we don't have anymore. And it's because of this access to vaccines, which I think is amazing. Donna, is there anything else you'd like to mention to our viewers around well child checkups and their specific importance for the children?
No, other than that, it's vital that we have this at least annual check-in with you all as parents and caregivers for your children. We're all here as partners to really promote the health and well-being of all of our children in our state, and that the Well Child is the vehicle that's been designed to allow us to do that. So please, think about making that appointment, and we're happy to be here to serve our population.
Well, thank you so much for joining us. I really appreciate this conversation. And like you mentioned, there are a lot of great resources around vaccines, which we'll post afterwards for people to look at. But if you or anyone you know who is watching right now is currently eligible for the COVID-19 vaccine, which is 16 and over for Pfizer and 18 plus for the other ones, you can go to intermountain.com/COVID vaccine to schedule your appointment. As soon as we find out that those who are younger than 16 are eligible for the vaccines, we will also update the public and provide more information on that. Some of those resources that Donna mentioned are the American Academy of Pediatrics, as well as the CDC and Intermountain Healthcare's own website. Again, we'll post all of those resources after for you to look at. Donna, thanks again for joining us, and we'll talk to you later.
Thanks so much.
Thanks.